So there's a very special test which is used in diagnosing hyperaldosteronism. This is what is known as a challenge test. Captopril Challenge Test. Captopril Challenge Test. So for this Captopril Challenge Test, we said it's a non-invasive, it's an outpatient procedure. It's used as a confirmatory test, if you want to establish that somebody has primary hyperaldosteronism. Now, what is a primary hyperaldosteronism? It's a condition where the adrenal glands are producing too much aldosterone, independent of renin regulation. So the test principles is this. Captopril is an angiotensin converting enzyme inhibitor. Okay, so normally to suppress aldosterone production by blocking the renin-angiotensin system, all right, because it is blocking the enzyme. Do you understand? So in healthy individuals and those with essential hypertension, plasma aldosterone should drop if you give captopril. But in primary hyperaldosteronism, aldosterone will still remain high, all right, and renin is suppressed, okay, indicating that there is an autonomous secretion. Okay, so that's why we use it. So these are the steps: preparation, the patient to discontinue any medication that can interfere with captopril, like diuretics, angiotensin converting enzyme inhibitors, angiotensin receptor blockers, beta blockers, for about 2 to 6 weeks. Baseline sampling: patients should sit for about 1 hour. All right, they draw blood from plasma. Okay, draw blood for plasma aldosterone. They measure like the baseline, how much of the aldosterone were you having before the test. So they administer captopril about 25 to 50 milligrams. Post dose sampling. So after 2 hours seated, they now still do another blood draw. You understand? To still measure the plasma renin activity and the aldosterone. So you can still be monitoring the patient as the time go on, 3 hours, 4 hours, like that. So interpretations: normal response, aldosterone suppression should be more than 30% of the baseline. That's what you initially measured. But if it is elevated, if it is still elevated, it indicates that there's a primary hyperaldosteronism.